all lights on the medical community as they race against time to find potential treatments and vaccines for COVID-19.
COVID-19.
And as many would want an accelerated pace in this effort, the World Health Organization says there are no shortcuts to efficacy.
We are currently mapping the vaccine candidates that are underway, that are in development. There's more than 120 vaccine candidates, and I'm sure there's far more than even we're mapping. Some of these are in clinical evaluation, which means they're being tested in people, and some are in preclinical evaluation.
Exploratory, preclinical, clinical development, regulatory approval, manufacturing, and quality control. This, in summary, describes the stages, but the timelines not definitive.
It will interest you to know that people have put in resources to developing vaccines for both SARS of 17 years ago and MERS of 8 years ago, and still, till now, there isn't any categorical effective vaccine for those two coronavirus.
The medications must be safe for use with proper dosage determined. Experts say the journey to this guaranteed safety is rigorous and thorough.
To develop a vaccine is a lot of work. It can last years. So for the COVID, I believe the earliest we can see a COVID vaccine is maybe a year to a year and a half. Right now, we don't have any COVID vaccine in Nigeria. We have people that have already made claims that they have one herbal medicine or the other for COVID. One person claimed that he has a COVID vaccine and it's herbal based, but it's difficult enough to make vaccines from virus, not to talk of from plants.
In the past months, a familiar name, chloroquine and hydroxychloroquine, have been mentioned, especially by President Donald Trump. Another familiar name has popped up in the search for a homegrown solution. Former Electoral Commission Chairman and Professor of Pharmacognosy, Professor Maurice Iwu, says he might have a cure for COVID-19.
What happens with viruses, by nature, they are not killed as such. What you do is to stop the replication of the virus, and then the body takes over. So when the laboratory studies, this compound at very, very low doses, we're able to reduce the replication of the virus.
To date, there are no specific vaccines for COVID-19, but different treatment options are under investigation. While the world waits for an acceptable medication or vaccine, for now, taking precautions seem like the most reliable option available for all. Dari Ido, Channels Television News.